Hello, everyone. It is so good to be back, and welcome to another episode of Alert and Aware. I am Dr. Leslie, your board certified emergency physician, best-selling author, international speaker, and the CEO and founder of Sharp Medical Group. To find out more about me, you can go to sharpmedicalgroup.com. Well, today's subject is monkeypox. So I was on a couple of weeks ago and I gave you some basic information on monkeypox, but I asked for your questions because I want to make sure that your questions are being answered and that you know exactly what's going on in regard to this disease. So let's start off with a little bit of statistics. So monkeypox here in the US, we are up to 21,000 cases. Now, worldwide, there's 56,000. So we are a large population of the monkeypox right now. As far as that goes, keep in mind that this is the first time that monkeypox is being spread more for people who there's without any international travel at all. So when it started out, it was first discovered in 1958, and that was just in a laboratory. They had some animals that they tested and they found this. In 1970 was the first time that it was discovered in people. Now, go forward again to 2003. That was the first case ever in the United States. Now, what is going on now, as I said, is different because these are people without any international travel, but it is being spread from person to person. So what is monkeypox? Well, first of all, it's a virus. It's similar to smallpox, the same family, totally different from chickenpox. So knock that out of your mind altogether, nothing to do with chickenpox whatsoever. And there are two types of monkeypox. I hope I'm pronouncing it right, but I believe it's clade A, clade 1, and clade 2. And the current one is clade 2. So that's the basic facts about this. How is it spread? That's the number one question. It is spread through skin-to-skin contact. That is the majority of it. Now, it can also be spread through respiratory droplets. When I say respiratory droplets, don't think in terms of coronavirus. It is not the same at all. We're talking about the droplets from face-to-face long contact. Okay? Not from somebody just sneezing on you once or you being in the room with someone. It doesn't stay or hang out in the air, nothing like that, but face-to-face contact. So it can also be spread by surfaces. So if you have someone who has a lesion and they touch a surface, that virus is going to stay on that surface. If someone else comes along, touches that same surface, that is a way of contacting. So that is what we worry about. That is one of the importance people ask about quarantining. So quarantining is important. If someone has the active virus, they want to make sure that any household contacts stay away. No skin-to-skin contact. And okay, that may not be so hard, but the thing is those surfaces. So that individual should use their own items. So their own washcloths, towels, dishes, glassware, anything like that should be separated. Another thing that you have to quarantine from, believe it or not, is your animals. So animals, because remember, this is monkeypox. It started out with the animals, is easily transmitted to your pets. So even your domestic pets can get it. So say your dog, loves to roll around in the laundry, the dirty laundry, because, dogs do things like that. They love those good smells. And so they're rolling around in the dirty laundry. They can also contract it. Other thing with animals is if an animal contracts it and it is outside running around, if it gets into the wildlife population, it can cause an endemic. So that's one of the things we worry about, particularly with the animals. Other things we got to think about is the symptoms. What are the symptoms? Well, like most viruses, they start out with fever, body aches, headaches. You may have some back pain, muscle pain, swollen lymph nodes, and you just feel tired. That's pretty much across the board, as I said, for most viruses. Now, the thing is the rash. The rash generally starts about 1 to 3 days after the fever. Oftentimes it's on the face, but it can literally be anywhere in the body, especially, obviously, if it is related to sexual contact in the genitalia. That being said, in previous cases in West and Central Africa, people had lesions all over. That is not necessarily the case. You can have as few as 1 to 2 lesions and you have monkeypox. So keep that in mind. It does not have to be all over the body. It can be in one isolated area. Hi, Dr. Acorn. Thank you so much for joining me today. I hope if you have any questions, feel free to type them in the chat. All right. The symptoms are mostly mild. And however, in children and young adults, it's actually worse than in older adults. Of course, there's exceptions. If you're immunocompromised, you do have a higher risk of having a more serious illness. Right now, there have been, as of, I believe it was Thursday, there have been 2 deaths in the United States, which we believe to be associated with monkeypox. That being said, I don't have any information about those individuals. I don't know what other medical problems they had, their age, their sex, nothing. So that's all we know right now. The first one was in Texas and the second one was in California. That's all we know. So how do I protect myself? All right, as I said, close contact with anyone who has lesions. Now, those lesions go through different stages. So question is, okay, so they have lesions. Are they always going to be infected? No. Once that rash heals, and that means going through all the processes of starting out with just a little bump, it may expand, it may become fluid or pus filled, that may break, a scab then forms. Once that scab falls off, and not until then are you considered no longer infective. So not until that rash clears. That's incredibly important. Now, one of the things I mentioned was that this is transmitted also through sexual contact. We don't yet know whether monkeypox is found in semen, for example. We don't know that. But keep in mind, wearing a condom is not enough. It's not enough because, yes, you're covering part of the body. You're not covering the rest of the body. So if you have lesions anywhere else, you can still contract it. Thank you so much for joining me, Melissa. I'm glad you're finding this informative. And if you have any questions, feel free to type them in the chat. All right. So condoms are incredibly important. Now, as I said, you're no longer infective once those lesions heal. However, it is recommended about wearing condoms for another 12 weeks after infection. Yes, I said 12 weeks. Okay, important number to keep in mind. Other things you want to keep in mind is you want to make sure if you're a caregiver to someone who has monkeypox, you're wearing gloves, you're practicing good hand hygiene. So washing your hands really well. As I said, making sure that those items that individual is in contact with do not be in contact with you. So how do we spot monkeypox? Well, first of all, they're firm, rubbery lesions. They're well circumscribed, and oftentimes they have a little central depression. Think of it, we call it umbilicated lesions. Think of it almost as having a little belly button in the middle. That's exactly what they look like. Once again, not the same as chickenpox at all. Now, how do I tell that from hives? That's one of the questions one of my viewers asked. Okay, so it's a rash. All right, very different. So monkeypox are extremely painful. Now, if you've ever had hives for any reason, you will know the biggest thing that you notice for hives is the fact that you itch. You itch like crazy. With monkeypox, it's not a matter of itching. It is just the pain. Also, the difference with monkeypox is, as I said, it goes through those different stages and they're often fluid filled. Okay, so before those lesions break open, they're fluid filled. Okay, hives don't have anything similar to that. And they're also well circumscribed. Hives tend to spread over a larger period of time, and hives don't last as long, and they're treated with antihistamines. That's not going to happen with monkeypox. So how long does it last? Count on it lasting for anywhere from 2 to 4 weeks. That's on average. And I'm back to this again about this whole idea about being contagious. Another viewer asked, are people with monkeypox scars contagious? No. As long as those lesions have healed, that scab has fallen off, you're no longer contagious. So what about vaccines? So the number one vaccine in the US and worldwide is called, I'm going to pronounce this Jynneos. Oh, I hope that's right. It's Jynneos. Now, that is approved for both monkeypox as well as smallpox. That's how this all started, because remember I said that this is very similar to smallpox, although not nearly as fatal as smallpox. The vaccine is given, there's 2 separate vaccines. They're given 28 days apart. And it is not until 14 days after the second vaccination that you are considered fully vaccinated. As I said, 28 days apart between the 2, but you can go up to 35. So just in case for any reason you wanted to get the vaccine and you were out of town or something like that and you could not get it immediately, you have up to 35. But after that time period, it's felt that it's not going to be effective, right? The other thing is, if you are exposed to someone who has monkeypox, you can get the vaccine up to 4 days afterward. Okay, very important. It's called post-exposure prophylaxis. You can receive that vaccine. Right now, the FDA is trying to get as many people vaccinated as possible. They're mainly going after the group that they feel is the most, where most of the cases are found, and that is men who have sex with men. So that is the number one in the United States. That is the majority of the cases. Keep in mind that it can still spread. Don't think because you're not among that group that you can't get monkeypox. As I said, it's more fatal, or I shouldn't say more fatal, I should say more serious in young people. We're talking our teenagers, we're talking our young adults, as well as anyone who's immunocompromised. So if you fall in that risk group and you feel that you want to get the vaccine, look for your local health clinics. Find out where you can get them. I know that there have been different fairs, health fairs and things like that where it's been offered. Find out what resources you have in your community. All right. Well, that's about all the information that I have today. And I thank you so much for joining me. I hope that this gave you some additional information. And this was another segment of Alert and Aware with Dr. Leslie. I, once again, am your board-certified emergency physician, best-selling author, international speaker, and the CEO of Sharp Medical Group. So if you want to find out more about me, how you can get in touch with me, go to sharpmedicalgroup.com. Make sure you remember my E, right? It's Sharp with an E, so sharpmedicalgroup.com. I look forward to talking with you again, and Melissa, you are very welcome, and I hope to bring you more information in the future. Until then, take care. Bye-bye.